again, everyone. We're back with Dr. Tatiana Haverluk to talk about point of care ultrasound, but talk about this case where a woman presented with some urinary symptoms.
Yes, so nice to be back again, Randy. And this was a patient who is 47 years old. No significant past medical history. She came in with a few days of dysuria and some chills in the last day or so, and then I was actually woken up with flank pain the morning of presenting to the primary care doctor. And when she arrived, she looked okay. Her vitals were okay. There was no fever, although she did take some Tylenol at home when she was having chills and pain. And she had some CVA tenderness on exam, but otherwise pretty unremarkable exam. So the provider was concerned for a UTI, and they got they performed a urine dipstick, and it was consistent with having a urinary infection. And because she was having some flank pain, pyelonephritis or early pyelonephritis was also a concern. So then there was this decision-making process where, does this patient just have a simple pyelonephritis, and can she be discharged home on oral antibiotics because otherwise she's healthy, her vitals are fine, versus is there something else more complicated going on? And because she had that kind of pain that woke her up from sleep, more of a colicky nature pain, the provider was concerned that maybe there's a kidney stone there. So they performed an ultrasound to see if there are any signs of a kidney stone. And when they did that, they found moderate hydronephrosis, which is basically obstructive pattern in the kidney when there is a stone or something else that's blocking the ureter. And because she had this obstructing kidney stone, it's actually a urological emergency. So these patients who have an infected urine and a stone that's obstructing, they can decompensate and become septic very quickly. So these are the patients that should be actually managed in the ER. They need to have a stent put in, they need IV antibiotics, they need a sepsis workup and close monitoring. So because this provider did POCUS, they were able to escalate that care for the patient instead of sending them home on just oral antibiotics and this patient decompensating at home.
So what specific findings suggest hydronephrosis on ultrasound?
So it's basically the presence of dilatation of the renal pelvis. And so if you just have dilatation of the pelvis, you will have some black or anechoic area. A lot of times it's pretty small, but it looks different from the other side. And it's in that in the middle of the kidney. So if you're looking at it in transverse view, in a normal kidney, the center should be hyperechoic, which is gray or whitish gray. While in the kidney with hydronephrosis, the center in the transverse view is going to be anechoic or black. So it's a quick way to see whether there is a hydronephrosis. But then we also qualify hydronephrosis, or classify rather, in mild, moderate, severe. So the mild one is the one that only has a distension in the pelvis. While the moderate one, the distension is spreading to the calyces. So it's pushing the calyces out and kind of flattening the pyramids in the kidney. And then finally, the last stage is severe hydronephrosis, which looks what we call a bear claw on ultrasound, but there you get a lot of anechoic space in the middle of the kidney that's extending all the way out, and the cortex is actually now thinned. So there is so much pressure in the kidney that the cortex of the kidney is smaller, and it's basically not functioning or not functioning well. So it's a definite emergency if you're seeing severe hydronephrosis.
So again, sort of documentation, billing, and coding, anything you need.
No, I mean, there are CPT codes for a limited renal ultrasound and limited bladder ultrasound. So you can use two codes, and it's really more about once again, medical decision-making. Not every case of pyelonephritis needs an ultrasound. It's only in certain cases, like in this patient where she had colicky pain and there was a concern, hey, maybe there is a kidney stone. And that's why the physician did it. And then so the indication needs to make sense. And then you have your procedure note, which also you put in, who did it, what time you did it, what views you obtained, what were your findings, what's your final impression. So pretty simple with that.
Yeah, I think it's, we talked about that early on, the importance of being able to bill for all of these different types of procedures, and when and how to do it is also always very important.
Yeah.
Anything else about this case that's remarkable that you'd like to share?
Well, I think my thought was still about billing. I was thinking about billing.
Yeah,
So
yeah,
I was going to say, like, another important thing is to make sure you're saving your images.
absolutely.
You shouldn't be billing without saving. And it's also medical legally, it's protective if you're saving your images as well. So that's really important. But yeah, I think in terms of this case, actually my mother-in-law recently had something similar happened where she was waiting around at home. She was having chills. And the PCP kind of waited a little bit too long to, until she actually ended up becoming septic, and she went into the ER and she needed a stent and IV antibiotics. But I was imagining, hey, if he could do POCUS in-house, oh, not in-house, but in his office, he would have picked up hydronephrosis and sent her to the ER earlier.
Well, and that's a common thread through a lot of these cases we've discussed, is that the idea is that you're finding things sooner and you're responding more quickly to things that are very susceptible to letting them go too long. Case after case, we've had that conversation. So again, finding out earlier, referring earlier, and getting out ahead of some of these things that could be very dangerous. So
Exactly.
another excellent case. Thank you for your time and for bringing this forward and sharing this information with us today.
Thank you, Randy. Always my pleasure.
Yes. Please support our mission to improve quality of patient care through education. Join us, follow us, and share this content with family and friends.